Hello friends, welcome to my channel, Nurses Toolkit. My name is Prosper. I am a registered nurse in the UK and in Ghana. On this channel we educate nurses, prospective nurses and the general public. In today's presentation we're going to go through a brief overview of OSCE. And so I'll entreat you to like, to subscribe and to share for others to also benefit from today's presentation. Now, when we talk about OSCE, which means Objective Structured Clinical Examination, is an exam that an internationally educated nurse who want to practice in the UK will have to write or undertake in order to get your registration to practice as a nurse. Now, OSCE has 10 stations. When we talk about 10 stations, the stations basically stand for the various areas that we have to cover, and so you are required to pass all 10 stations. You have to pass all 10 areas. We starting with the first 4 stations, which is what we term as APIE. APIE, that is APIE, which stands for Assessment, Planning, Implementation, and Evaluation. And then we also have what we call clinical skills. At present, we have 22 clinical skills. And then also have what we call evidence-based, which is about 16 in total, and we will be required to write on 1. We also have what we call professional values, which at present we have 16, and you'll be required to write on 1. Now let me take you from the APIE and walk you through. The APIE, as I earlier on stated, APIE, the A stands for assessment, where you are introduced to a patient for the first time, and as a nurse, you will do an assessment on such a patient. And on your assessment, you go through it by using what we call A to E assessment, where A stands for airway, B stands for breathing, C stands for circulation, D stands for disability, and E stands for exposure. In each of all these parameters, there are some requirements or there are some things that you are expected to look out for as a nurse, and you'll be marked on how accurate or how good you are on those things. From assessment, we now move on to planning. With planning, you're basically going to write care plans. You need to have 2 problems from your assessment stage. So you carry them to your planning stage, and then you draw care plans on those 2 problems that you've identified. And after your care plans, you are supposed to do intervention, write intervention. From the planning stage, you now move on to implementation. When we talk about implementation, all I want you to have in mind is drug administration. You are going to give a drug to your patient at this stage. From this stage, you now move on to what we call evaluation. With evaluation too, you should be thinking about verbal handover, which could be that you are handing over to a colleague nurse or any other healthcare professional. So basically, this is what APIE is about, and it forms the first 4 stations. One thing I would like you to note is the fact that the same patient you carry from assessment, you carry that same patient through from assessment to evaluation. But you should always be careful in between assessment and planning. It's possible at assessment, the patient you are seeing or you are assessing may be at the level of preparing to be sent to the theater. And so at planning, you'll be seeing or dealing with a post-operative patient. And so let's take note at this point so that we'll know how to go about with our care plans. I'll be coming out with videos with the various stations so that we can get details about them. Now, from the APIE, we now move on to the clinical skills. At present, we have 22 clinical skills. Most of the time, you have 2 paired skills, but it's not a guarantee There are times they may give you individual skills, which is 4 in total, and each skill has its required time. And so I will entreat you to abreast yourself with the timings, so that when you are preparing, you know how to go with your timings. From the clinical skills, we move on to the written stations, which I earlier on stated that we have professional values and then evidence-based. With evidence-based, at present we have 16, and you'll be given a scenario to write about one. To be an article, and you'll be required to summarize it in bullet points. And so you have to know all the 16, because you don't know which one you are going to get on the day of your exam. From that one, we move on to the professional values. The professional values are actually based on the codes. And so if you don't know much about the NMC codes, I will advise that you read on them, so that when you go in to write your OSCE exam, you'll be able to go through it once and for all. Now, before I end, I would like you to know that the exam does not follow in order. Yes, APIE, assessment comes before planning. Planning comes before implementation, and implementation comes before evaluation. So for those 4, it's constant that they will follow, but the others do not follow. And then you could also start from professional values and go to evidence-based, or it could be that you may start with the clinical skills. So you are not guaranteed, but when it comes to the APIE, it follows in order. And so as you prepare to write your OSCE exams, I will advise that just be prepared that whichever comes first, you'll be ready to start it. And then I will also advise you that one key success to OSCE exam is continuous practice. You have to practice. But when you are practicing, make sure you always detect your errors. And then when you are practicing, you will not be practicing with the errors, but then you practice towards perfection. For those who are preparing to write their OSCE exam in the next few weeks or months, I wish you good luck. And I will also ask that you subscribe, you like and share, so that others will also benefit. Thank you for supporting the channel.